Every 40 seconds, somewhere in the world, someone suffers a stroke. By the time you finish watching just the first minute of this video, another family may be rushing someone to the hospital, confused, terrified, and wondering why there was no warning. But here is the part most people never hear clearly enough. A stroke does not always arrive without warning. In many cases, the body gives signals before the major event happens. Sometimes these signals appear hours before. Sometimes they appear a day before. Sometimes they come and disappear so quickly that people convince themselves it was nothing. A strange moment of blurry vision, a sudden numbness in one hand, a few seconds of slurred speech, a dizzy spell that feels like losing control of your body. And because the symptom goes away, the person thinks, "I'm fine now." But that temporary relief can be dangerous, because in the world of stroke prevention, a symptom that disappears is not always a harmless symptom. Sometimes it is the brain sending one of its final warnings. This video is about those warnings, not to scare you, not to make you panic, but to help you recognize what many people ignore until it is too late. A stroke is one of the leading causes of death and long-term disability worldwide. It can change a person's life in minutes. Speech, movement, memory, independence, and even personality can be affected when part of the brain loses blood flow. And that is exactly why time matters so much. Your brain is not like other organs. It cannot wait calmly while the body figures things out. Your brain needs a constant supply of oxygen and glucose every second of the day. Even though it represents only a small percentage of your body weight, it consumes a massive amount of your oxygen and energy. It is the command center of your body. It controls your speech, your movement, your balance, your memory, your breathing patterns, your emotions, and your ability to respond to the world around you. So when blood flow to part of the brain is interrupted, even briefly, brain cells begin to suffer very quickly. This is why doctors often say, "Time is brain," because every minute can make the difference between recovery and permanent damage. Before we go deeper, let's make one thing clear. There are different types of stroke. One type is called a hemorrhagic stroke. This happens when a blood vessel in the brain bursts, causing bleeding in or around the brain. That blood can compress brain tissue and create a life-threatening emergency. Another type is called an ischemic stroke. This happens when a blood vessel supplying the brain becomes blocked. Blood cannot reach a specific area of the brain, and the cells in that area start to die. Ischemic strokes are the most common type, and they are often linked to blood clots, plaque buildup, artery narrowing, heart rhythm problems, and long-term damage inside the blood vessels. But here is where most people misunderstand stroke. They imagine it as something sudden, like a lightning strike. One moment the person is normal, the next moment they collapse. And yes, sometimes it looks that way from the outside, but inside the body the process often begins much earlier. For years, blood vessels may be getting damaged silently. The inner lining of the arteries may become irritated. Plaque may start building up. Blood pressure may be stressing the vessel walls. Blood sugar may be injuring the delicate surface inside the arteries. Smoking, inflammation, poor circulation, heart rhythm problems, and other risk factors may slowly create the perfect conditions for a blockage. Then one day, a small clot forms, or a tiny fragment of plaque breaks loose, or an artery that is already narrowed suddenly cannot deliver enough blood, and then the brain reacts. Sometimes, before a major stroke, the body experiences what doctors call a transient ischemic attack, often shortened to TIA. Many people call it a mini-stroke, but that name can be misleading, because there is nothing mini about the warning. A TIA happens when blood flow to part of the brain is temporarily reduced or blocked. The symptom may last seconds or minutes, and then it disappears. The person may look normal again. They may speak normally again. They may walk normally again. But the danger has not necessarily disappeared. The body may have just revealed that a serious blockage, clotting problem, or circulation issue is already present. That is why a temporary stroke-like symptom should never be ignored. One of the most dangerous mistakes people make is waiting to see if it happens again. They say, "It only lasted a minute." I was probably tired. Maybe I stood up too fast. Maybe it was my blood pressure. Maybe I slept wrong. And sometimes, yes, symptoms can have less serious causes. Not every dizzy spell is a stroke. Not every numb hand is a brain emergency. Not every headache is a vascular problem. But when a symptom is sudden, unusual, one-sided, affects speech, vision, balance, or coordination, and appears without a clear explanation, it deserves urgent medical attention, especially if you are over 50. Especially if you have high blood pressure, diabetes, prediabetes, high cholesterol, smoking history, heart disease, atrial fibrillation, obesity, or a family history of stroke, and especially if the symptom goes away quickly, because that is exactly what makes people ignore it. The warning disappears before fear has enough time to become action. One of the classic warning signs that can appear before a stroke is sudden temporary vision loss in one eye. Imagine this. You are walking through your house, maybe going to the kitchen, maybe getting ready for the day. Suddenly, one eye becomes dark, blurry, foggy, or covered, almost as if someone pulled a curtain down over your vision. You blink. You rub your eye. You wait a few seconds. Then your vision comes back. And because it came back, you continue your day. But that episode may not have been an eye problem at all. In some cases, temporary blindness in one eye can happen when a tiny clot or plaque fragment briefly blocks blood flow to the retina, the light-sensitive tissue in the back of the eye. The artery that supplies the eye is closely connected to the same circulation that supplies the brain. That means a warning in the eye can sometimes be a warning about the brain. Doctors may call this kind of temporary vision loss amaurosis fugax, which means fleeting blindness. And when someone describes it clearly, especially as a curtain-like darkness over one eye, it is taken seriously because it can be connected to artery disease and future stroke risk. The terrifying part is this. The same tiny clot that temporarily affected the eye could have traveled into a brain artery instead, and instead of a short episode of vision loss, the result could have been paralysis, speech loss, permanent disability, or death. That is why temporary vision loss in one eye should never be brushed off as just tiredness, age, screen time, or needing new glasses. A second warning sign many people ignore is sudden numbness or tingling on one side of the body. This may affect one hand, one arm, one side of the face, one leg, or the entire left or right side. The feeling may be described as pins and needles, heaviness, cotton, weakness, rubber, or a strange loss of control. Now, it is important to separate this from something common. If you sleep on your arm and wake up with numbness, that is usually related to pressure on a nerve. When you change position, the sensation comes back. But if you are sitting normally, walking normally, talking normally, and suddenly one side of your body becomes numb or strange for no obvious reason, that is different. That may not be coming from the arm or the leg. It may be coming from the brain area responsible for sensation and movement. Stroke symptoms often affect one side of the body because each side of the brain controls the opposite side of the body. So when blood flow is interrupted in one area, the symptoms may show up on only one side. This is one of the details people must remember. Sudden one-sided symptoms are more concerning than general tiredness or vague discomfort. If one side of your face feels different, one arm becomes weak, one leg does not respond properly, or one side of your body suddenly feels numb and then improves, that can be a warning sign. And even if it lasts only a few minutes, you should not treat it like nothing happened, because a disappearing symptom can still be a serious symptom. Before we continue with the next warning signs, leave a like on this video so more people over 50 can receive this information before they need it. And if you want clear, practical health explanations that help you protect your body as you age, subscribe to the channel and stay with me until the end, because the next signs are even easier to dismiss. And one of them is often mistaken for simple dizziness, when it may actually be the brain struggling for blood flow. The third warning sign is sudden loss of coordination. And this is one of the most dangerous signs because many people explain it away. They say, "I just lost my balance. I must be tired. My legs are weak today. Maybe I got up too fast." But sometimes, What looks like a simple balance problem may actually be a warning from the brain. Imagine you are walking across a familiar room. The floor is flat. There is nothing in your way. You are not drunk, you are not dizzy from medication, and you did not trip on anything. Then suddenly, your foot lands in the wrong place. Your body leans to one side. You reach for the wall, a chair, or the door frame because for a few seconds, your body does not feel under your full control. Or maybe you feel a sudden spinning sensation, so intense that you have to stop immediately. It comes without warning. Then, after a few moments, it passes. You stand there confused, but because you recover, you move on. This can be a serious mistake. Balance and coordination are not controlled by your legs alone. Your legs are only following instructions. The command comes from your brain. One of the main areas involved in coordination is called the cerebellum. It sits low in the back of the skull and works almost like a silent control system. It helps your body walk straight, adjust posture, coordinate muscle movement, and keep balance without you having to think about every step. When blood flow to this region is reduced, even briefly, your coordination can suddenly fail. This may show up as a drunk walk without alcohol, a sudden stumble, a strange inability to walk straight, a feeling that one leg is not obeying, a sudden violent dizziness that does not feel like your usual dizziness. And here is the important detail. Not all dizziness is a stroke warning. Many people have dizziness from inner ear problems, dehydration, medication, anxiety, low blood sugar, or changes in position. But sudden, intense dizziness combined with trouble walking, weakness, one-sided numbness, vision changes, or speech problems should be treated very differently, especially if it appears out of nowhere, especially if it feels unlike anything you have experienced before, and especially if you are over 50 or have risk factors like high blood pressure, diabetes, smoking history, heart disease, or previous circulation problems. A stroke affecting the back part of the brain can be especially tricky because it does not always begin with dramatic paralysis. Sometimes the first sign is balance. The person does not fall unconscious. They may not feel chest pain. They may not even realize their brain is involved. They simply feel unstable, strange, or suddenly unable to coordinate the body. That is why unexplained balance problems should never be ignored when they happen suddenly. The fourth warning sign is sudden trouble speaking. This is one of the classic stroke warnings, but many people still miss it because it may last only a few minutes. A person may suddenly slur their words. They may know exactly what they want to say, but the words do not come out correctly. They may speak slowly, strangely, or with a heavy tongue. They may mix up words. They may say sentences that do not make sense, or they may look confused when someone speaks to them, as if the words are no longer being understood properly. This is very different from occasionally forgetting a word. Everyone has moments where they forget someone's name, lose a word in conversation, or feel mentally tired. That alone is not what we are talking about here. The warning sign is sudden speech breakdown, a clear change. Something that makes you or someone near you think, "This is not normal." Speech depends on highly specialized areas of the brain. In many people, these areas are located on the left side. One area helps produce words and control the muscles involved in speech. Another area helps understand language and organize meaningful sentences. When blood flow to these regions is interrupted, speech can be affected almost immediately. The person may understand everything but cannot speak clearly. Or they may speak fluently, but the words come out confused or meaningless. Or they may not understand a simple question. And then, after a few minutes, everything returns to normal. That is when the dangerous thought appears. Well, it passed. But when speech suddenly fails and then recovers, that can be a major warning sign of a transient ischemic attack. It is not something to laugh off. It is not something to hide because you feel embarrassed. It is not something to blame automatically on stress, age, or lack of sleep. If your speech suddenly changes, or if someone close to you suddenly speaks in a way that does not sound right, you should think of stroke until a medical professional rules it out. There is a simple stroke recognition tool many people have heard of. face, arms, speech, time. If the face droops, if one arm becomes weak, if speech is slurred or strange, it is time to seek emergency help. But remember this, you do not have to wait for all signs to appear. One sudden sign can be enough. One brief episode can be enough. One moment of speech loss can be enough to justify urgent evaluation. Because the goal is not to prove at home that it is a stroke. The goal is to avoid losing the narrow window where doctors may still prevent a larger event. The fifth warning sign is more complex, and many people do not connect it with stroke risk at all. It is the combination of unusual headaches with signs that your blood vessels or immune system may be under stress. Now let's be careful here. Most headaches are not strokes. Many headaches come from tension, dehydration, vision strain, sleep problems, sinus issues, medication, high blood pressure, neck problems, or stress. So this is not about panicking every time your head hurts. What matters is a headache that is new, unusually intense, different from your normal pattern, or appears together with other warning signs. For example, a headache that comes with sudden weakness, a headache with trouble speaking, a headache with vision changes, a headache with confusion, a headache with loss of balance, a headache that feels like the worst headache of your life, a headache that appears suddenly and violently. These situations deserve urgent medical attention. In the original medical discussion behind this topic, there is also mention of skin changes such as vitiligo, which is a condition where patches of skin lose pigment and become pale or white. Vitiligo itself does not mean someone will have a stroke. Many people with vitiligo never have one. But vitiligo is connected to immune system activity, and in some people, autoimmune or inflammatory conditions may also affect blood vessels. Inflammation can damage the inner lining of arteries, making them less smooth and more vulnerable to plaque buildup or clot formation. The inner lining of your blood vessels is called the endothelium. Think of it like a smooth protective layer inside your arteries. When it is healthy, blood flows more easily. But when that lining becomes damaged by inflammation, high blood sugar, smoking, high blood pressure, or other stressors, the artery becomes more vulnerable. Cholesterol particles, platelets, and inflammatory substances may begin to stick to damaged areas. Over time, this can contribute to narrowing, plaque, and clot risk, so the important message is not that one skin condition automatically predicts a stroke. The message is this: when your body develops new, unusual symptoms, especially intense headaches combined with neurological signs or known vascular risk factors, you should not simply cover the pain with pills and ignore it. A changing headache pattern deserves a conversation with a doctor. A headache plus neurological symptoms deserves urgent evaluation, and a sudden severe headache should never be treated casually. This matters because many people over 50 already have risk factors they underestimate. They may have high blood pressure, but say, it's only high sometimes. They may have prediabetes, but say, it's not diabetes yet. They may smoke, but say, I don't smoke that much. They may have high cholesterol, but say, I feel fine. They may have occasional heart flutters, but say, it's probably anxiety. But stroke risk is often built silently. It is not only about how you feel today. It is about what has been happening inside your arteries for years. And this is why the 24 hours before a stroke are so important. Because the warning signs may not look dramatic. They may be brief. They may disappear. They may seem unrelated. One eye goes dark for seconds. One arm tingles and then feels normal again. The body suddenly loses balance. Words come out wrong and then return. A headache feels different, stronger, stranger, or appears with other symptoms. These are not moments to ignore. These are moments to write down, report, and act on. And here's something very important. If you experience sudden symptoms like face drooping, arm weakness, speech difficulty, vision loss, confusion, severe dizziness, loss of coordination, or a sudden intense headache, do not drive yourself to the hospital. Do not wait to see if it happens again. Do not take aspirin or blood thinners on your own unless a doctor has specifically told you to do so for your situation, because not every stroke is caused by a blocked vessel. Some strokes are caused by bleeding, and taking blood-thinning medication without knowing what is happening inside the brain can be dangerous. The safest decision is to seek emergency medical care. The faster a stroke or TIA is evaluated, the better the chance of preventing permanent damage. Before we move into the final part, I want you to remember this phrase. If it is sudden, one-sided, affects speech, vision, balance, or strength, and feels unusual for you, do not ignore it. That one sentence can save a life. In the next part, we will talk about what actually damages your blood vessels from the inside, why normal cholesterol does not always mean you are safe, what happens with blood pressure during the night, and the key medical tests you can ask your doctor about if you have experienced any of these warning signs. And if this information is helping you, subscribe to the channel, leave a like, and share this video with someone over 50 who needs to hear it before a warning sign appears. Because when it comes to stroke, the symptom that disappears may be the warning that matters most. Now that you know the warning signs, we need to talk about what makes those signs more likely to appear in the first place. Because a stroke usually does not begin on the day it happens. In many people, the process starts years earlier, silently, inside the blood vessels. One of the biggest mistakes people make is thinking, my cholesterol is normal, so I'm safe. But stroke risk is not only about cholesterol. It is also about the condition of the inner lining of your arteries. This lining is called the endothelium. When it is smooth and healthy, blood flows more easily. But when it becomes damaged, the artery becomes a place where plaque, inflammation, and clots can begin to form. One of the biggest enemies of this lining is high blood sugar. Even before a person develops full diabetes, prediabetes can quietly damage blood vessels. Sugar in the blood can injure the delicate artery walls, making them stiffer, rougher, and more vulnerable to plaque buildup. That is why a person can feel completely normal, while their vessels are slowly becoming less flexible and more dangerous. Another major enemy is smoking. Cigarette smoke does not only affect the lungs, it also attacks the blood vessels. It makes the blood more sticky, increases inflammation, damages the artery lining, and raises the chance of clots forming. For someone with already narrowed arteries, this can be a dangerous combination. Then there is blood pressure. High blood pressure is one of the strongest risk factors for stroke. Over time, it puts constant pressure on artery walls, making them weaker, thicker, and more damaged. But there is something many people do not realize. Some ischemic strokes may happen when blood pressure drops, especially during sleep. At night, blood pressure naturally goes down. For a healthy person, this is normal. But if an artery is already narrowed by plaque, that nighttime drop in pressure may reduce blood flow even more. If a clot forms or gets stuck in that narrowed vessel, part of the brain may not receive enough blood. That is one reason some people go to sleep feeling fine and wake up with stroke symptoms. Age also matters. After 50, stroke risk rises because blood vessels have had more years of exposure to pressure, sugar, inflammation, smoking, stress, and other damage. But strokes can also happen in younger people, especially when there are heart rhythm problems, clotting disorders, autoimmune conditions, aneurysms, or trauma to the head or neck. So what should you do if you notice one of the warning signs? If you suddenly experience vision loss in one eye, numbness or weakness on one side of the body, trouble speaking, sudden loss of coordination, confusion, facial drooping, or a severe unusual headache, do not treat it casually. Do not wait for the symptom to return. Do not drive yourself. Do not take aspirin or blood thinners on your own unless a doctor has specifically instructed you to do that. And do not assume that because the symptom disappeared, the danger disappeared too. The safest decision is to seek urgent medical care. Doctors may need to check whether you had a transient ischemic attack, whether an artery is narrowed, whether your blood sugar is damaging your vessels, or whether your heart rhythm is creating clots. There are 3 exams worth asking your doctor about if you have had warning signs or strong risk factors. The first is a carotid ultrasound. This exam looks at the arteries in your neck that carry blood to the brain. It can help detect narrowing or plaque buildup. The second is HbA1c, also called glycated hemoglobin. This blood test shows your average blood sugar over the last few months and can reveal prediabetes or diabetes even when a single fasting glucose test looks acceptable. The third is heart rhythm monitoring, such as a Holter monitor. This records your heartbeat over many hours and can help detect atrial fibrillation, a rhythm problem that can cause clots to form in the heart and travel to the brain. These tests do not replace medical evaluation, and not everyone needs all of them. But they are useful conversations to have with your healthcare provider, especially if you are over 50 or have risk factors. The main message is simple. A stroke is often not a surprise to the body. It may be the final result of silent damage that has been building for years. And sometimes, before the major stroke happens, the body sends warnings. A curtain of darkness over one eye, a numb arm or face, a sudden drunk-like walk, speech that breaks down, a headache that feels different, severe, or comes with other neurological symptoms. If any of these happen suddenly, even for just a few minutes, take it seriously. Write down what happened, what time it started, how long it lasted, what side of the body was affected, and whether speech, vision, balance, or strength changed. That information can help doctors act faster. And remember, this video is for education. It does not replace a doctor, emergency care, or proper medical testing. If you believe you or someone near you may be having a stroke, call emergency services immediately. If this video helped you understand the warning signs, subscribe to the channel, leave a like, and share it with someone over 50. Because sometimes the sign that lasts only a few seconds is the warning that can save a life.